Today I want to talk to you guys about hand hygiene compliance among nursing students. As we know, nursing students are the future of healthcare, so we want to work on any issues that may occur. Hand hygiene compliance among nursing students. The purpose of this study is to improve hand hygiene compliance among nursing students, in particular, licensed practical nursing students, LPNs. Healthcare-associated infections, historically called nosocomial infections, are infections that a patient has contracted while admitted to the hospital. The patient is considered to have HAI if they are diagnosed on or after the third day of admission. Approximately 1 in 31 patients in the United States contract at least one HAI. The Centers for Disease Control, CDC, estimates this as 680,000 with 72,000 people deaths from an HAI during hospitalization. That's a pretty significant number for something that could have been prevented, right?
Yes.
Nursing students are the future of healthcare and therefore the future of frontline disease prevention. Many nursing students were certified nurse aides before starting a nursing class. Local LPN class of 2027 has 19 students, 16 of whom are CNAs already. So 84% of them could already have developed deficient habits. The goal of this study is to increase awareness and compliance among nursing students and nip deficient habits in the bud. According to the World Health Organization, WHO, hand hygiene, which is thorough washing of hands or utilizing hand sanitizer, is the single most effective way to prevent infection and up to 50% of the global HAIs. Despite book learning, nursing students have demonstrated low compliance during clinicals. Some students tend to follow others, so if the CNA or nurse they follow does not practice adequate hand hygiene, they may fail to do so as well. So the nurse walks out, doesn't wash their hands, doesn't use hand sanitizer, the students just follow right along, so they don't use the hand sanitizer. When asked why they did not wash their hands, responses such as "I forgot" or "there wasn't any hand sanitizer available" were given. The purpose of this proposal is to address and evaluate preventable contact-transmitted infections such as C. diff, which is a highly contagious germ that after taking an antibiotic can reduce beneficial bacteria in your stomach, allowing that bacteria to take over. Methicillin-resistant Staphylococcus aureus, also known as MRSA, is a type of infection that you can no longer treat with the majority of antibiotics. You can't just take your regular penicillin or augmentin or something, names that you would know. You have to get a stronger antibiotic. The influenza, the seasonal flu, is highly contagious and it spreads through unwashed hands. And the coronavirus, COVID-19, which we're all very familiar with, is a highly contagious respiratory illness that can become life-threatening, can travel through the air in droplets, and when someone touches these and then touches their face and they haven't washed their hands, they can get that illness. Nursing students are taught to reduce or eliminate through standard hygiene protocols during clinicals. HAI presents a severe patient crisis. Improper adherence to hand hygiene protocols can affect nursing students, patients, and even other staff, because they can touch that surface too. The benefit of this study is that it provides evidence-based practice to develop a safer environment for all. Therefore, there is an urgent need to ensure nursing students comply. By using a quantitative approach, a checklist in a clinical setting can be used to measure compliance, increase awareness, and nip deficient habits in the bud in the LPN class of 2027 for the end of the workforce. I'm going to have Hannah hand out a tool that I'm going to reference to in a few minutes, but I forgot to have her do that, so I'll have her do that now. Sorry about that, guys. Expected outcomes: a measurable increase in hand hygiene compliance among the LPN class of 2027. By using quantitative checklists, this intervention aims to raise students' awareness of gaps in their daily practice. Encouraging students to comply with standard hygiene protocols will immediately reduce the risk of contact-transmitted germs. Correcting these behaviors will limit the spread of HAI, including C. diff, MRSA, flu, and COVID-19. Reinforcing proper hand hygiene and discouraging the crowd from following can also break the cycle of students shadowing non-compliant staff. The structure will encourage students to nip deficient habits in the bud, as 84% entered as previously CNAs, thereby establishing correct, evidence-based muscle memory. By instilling the strict hand hygiene compliance, there will be a broader culture of safety, reducing mortality rates and protecting the overall health of the medical community. So if you're washing your hands, you're thinking about it, and it goes back to your muscle memory, make sure you remember, I just come out that door, let's grab a hand sanitizer, let's wash our hands. And so the key terms we spoke of above. Literature review, nursing students' deficiency in hand hygiene practices are a problem for patient safety. HAIs are a major cause of patients getting sick, even though that could have been prevented. Contaminated hands of healthcare workers, including students, are a major route for the spread of germs. Even though nursing students know about proper hand hygiene, they do not always follow the guidelines when they're in that hospital setting. This review examines 6 recent studies to assess how they conducted their research, who was tested, how they analyzed the results, and what they found. Researchers use different approaches to see why students do or do not wash their hands. These studies use quantitative research, relying on data and statistics to assess how often students followed hygiene rules and whether training was effective. DeMea Martinez examined the relationship between students' grade levels and their hand washing expertise. To examine cause and effect, Shane randomly assigned first-year students to groups to test different teaching methods and determine which group learned the best technique. This showed hand washing skills would be improved. Other researchers use qualitative research focused on feelings and real-world problems. Giabol and Labigan reviewed prior studies and found that when staff set a poor example or lacked essential supplies, students struggled as well. LeBrec conducted interviews with students to understand their fears, personal experiences, and frustrations in the hospital. Finally, Gochi had students discreetly watch healthcare workers in 20 nursing homes to count how many times that they actually washed their hands. Sampling sizes and process. Studies chose their group size based on what they wanted to improve. The studies that used math and numbers required larger groups to ensure their data was accurate. For example, DeMea Martinez tested 280 nursing students from various grade levels because they were readily accessible, just like the class of 2027 is readily accessible to me. However, testing people who are easy to find can sometimes lead to biased results, whereas having a large group allows researchers to compare first and second year students easily. Shane split entire classrooms of first year students into random groups. They did this so the students in training wouldn't share their secrets or skills with the other group. So group 1 wouldn't go tell group 2, so group 2 was prepared more, because group 1 might have messed up, but then group 2 wouldn't have messed up as much because they got to cheat basically. Measurement approaches and tools. To get an accurate picture of hand washing, researchers used a variety of checklists, surveys, and technology. DeMea Martinez used self-report surveys that included a who, quiz, and scale. Surveys are an easy way to check what students know, but they have a flaw. Students can lie to make themselves look better. We hope students wouldn't lie, right? To fix this problem, Gannon used an official checklist combined with video recordings. Multiple people could then watch the videos and check off the hand washing without guessing. So, did they wash their hands or not? You watch the video? Yes, they actually did. They went to the sink, they washed their hands. Some newer studies have used technology to track students. Malacar used checklists and ultraviolet gel scanners. Students rubbed lotion on their hands, washed them, and then they held their hand over black light. So I had previously taught students, and I would put the powder on their desk, and when they come back from lunch, they would get on their hand and we use a black light. Well, that backfired sometimes because somebody's like, what's this powder all over my desk? So you can see how that would work. So what this survey showed was the scanner would show them when they didn't wash, and the researchers found that the tips of the fingers, the spaces between their fingers, and the wrists is what was missed the most. Sandikin used real-world tracking using the Who, My, 5 Moments checklist. You guys have seen these before. It does the circle going around on the count. They discovered that they washed their hands before touching the patient, but not after. So when should we actually wash the most, do you think? After, because that's when you've been around the most germs. I don't know what's going on with this timer. Studies show that although nursing students want to keep patients safe, in the real world they struggle to do so. The combination of heavy workloads, other staff setting a poor example, and a lack of hand sanitizers and individual sinks make it hard for them to follow proper hygiene rules. A quantitative research approach has been used to determine whether a structured intervention produces a change from the baseline. The study aims to evaluate the measurable impact of an educational intervention on nursing students' knowledge and physical compliance rates. The hypothesis is nursing students will complete multi-hand hygiene training programs with checklists and reminders, will demonstrate higher hand hygiene compliance scores and knowledge levels compared to the classroom lectures done. So, if you're reminded about it, you think about it, you get that muscle memory, right? A quantitative approach will be used to measure real-world behaviors and provide numbers that demonstrate the training works. You can see and count hand washing. Using checklists will show improvement in the percentages. There's a clear gap between what the students show in classroom and what they actually do at the hospital. By showing students the checklist, they can improve their hand hygiene practices. It also keeps personal biases out of the equation. The study then can be repeated with other classes. Using numbers also aligns with evidence-based practice. By collecting exact percentages, we can see whether training and checklists makes a difference. A qualitative approach does not provide a tool or show whether people would wash their hands more. Using the observational developed by the West Virginia Department of Health and Human Resources, which I have included here at the end as appendix, and that is what Anna handed out. Nursing students are the future of frontline disease prevention. The goal of this study is to increase awareness and compliance among nursing students and nip deficient habits in the bud and reinforce proper hand hygiene. Population and sample size, all 19 nursing students in the 2027 LPN class. They are the target group whose hand hygiene compliance will be evaluated. They are the future frontline workforce. Future patients and clinical sites will be indirectly affected through improved infection control practices. The entire class will be used, so the approach will be sampling. All 19 students will be necessary to gather sufficient data volume to ensure the findings accurately reflect behaviors. Participants will be observed as part of their continuing education. The primary researcher will inform the class in a brief announcement before clinical the next day that there will be 2 observations, the first day and any hand hygiene moments, and we'll discuss it. And then they will be informed the next clinical day to see if there's improvements. So the announcement will let them know that it's an educational tool for continuous hygiene improvement. No clinical grade will be affected due to these audits. And if any student does not want to participate, be observed, they have the right to refuse. But there will be no names used, only numbers to remain anonymous. Data will be gathered using direct observation, using the observational developed by the West Virginia DHHR. The main asset of this tool is the observational method. Sorry about that. Which provides objective validity by capturing real-time hand washing behaviors in a clinical setting rather than relying on self-reported questionnaires, which can be biased. However, there could be a Hawthorne effect where nursing students temporarily increase their compliance because they know they're being watched, like they're watching me, I better wash my hands. The observer will be in rooms with them and in the halls as on usual clinical days. When a student uses one of the 5 specific hygiene hand indicators, the observer will log it into the West Virginia DHHR tool. Each hand hygiene opportunity will be marked as yes, hand hygiene was performed correctly, or no, hand hygiene was not performed correctly. For example, student 1, yes. Once the researcher has completed the log, the initial checklist, the student numbers will be shredded. So there's no way to track back who I used, or the researchers used. Project outcomes. The data collected through the DHHR tool will provide quantitative data with structured tallies to break down where the deficiency may occur. The analytical approach will utilize descriptive statistics to evaluate the baseline metric. The researcher will calculate the overall percentage. The WVDHHR tool standardized nature supports the reliability of this method. These are state-defined hand hygiene opportunities. Because the group is small with 19 students, it cannot be actively used as a bias for nursing students everywhere. That wouldn't be fair, right? However, it will offer feedback to this specific group of students. The goal is 80%. Does anybody have any questions?
Can you explain this paper to us a little bit?
So as you look up here and it says the hand hygiene tool, and I actually have it up here on the screen too. So like I said, it would be like student 1, before touching a patient, yes they did it. Or before using a cleaning aseptic technique, no they did not do it. So as you see, we can add all that up, and then down here at the bottom, we can tally it.